Today I want to talk to you about a very cool case that we started 2 weeks ago. So this lady came in, last minute call, can I come in today? Was referred by one of our patients, existing patients, and basically she had to drive a long distance to get to work, and it had gotten to the point where she could no longer drive the whole distance because of pain just shooting down her leg, a condition commonly known as sciatica. So she came in that day. I could see by her face she had like a face of pain. She was in agony. So I invited her to come into our doctor's report, which is, by the way, our class that we do for new patients on Wednesday nights. 45 minutes, educated her on what chiropractic care was, what we did, the science behind what we do, which is structural care, and gave her her first adjustment that night. She came back the following day, said, you know what, not much difference, pain is still there. But after the second appointment, she was able to drive the whole distance to work without pain in her leg. So obviously this patient comes in totally different, smile on her face, happy, hopeful. And now with her third adjustment that we've given her last week, she says, Clayton, I can say that there's no pain in my leg and I'm just left with a little bit of pain in my back. Now, how many people would, with that symptom or with those symptoms, go to their medical doctor? Medical doctor offers what? In this case, I can tell you from, discussing it with my own medical doctor and, the doctors that I interact with, that it is going to be either a muscle relaxer or a painkiller prescribed. Now, obviously, it's great. It's going to make the pain go away. But her condition, this patient I was telling you about, had a severely rotated pelvis, and her L5 was rotated as well, which is the area of the sciatic nerve. So obviously there is no pill, there is no muscle relaxer, no painkiller that can actually physically move a pelvis back in alignment. So here's what happens. The condition stays there. The pain goes away. And what does that do? When we feel good, we do more. And we harm ourselves. And we hurt the area that's already dysfunctional. And by virtue of the pelvis not being fixed, the condition worsens. So the typical patient that goes to her medical doctor or to his medical doctor that gets prescribed pills for pain usually gets worse. And what happens, the episodes of pain start to be more frequent, they start to last longer, and the recovery rate is longer and longer, to the point where now the patient is experiencing chronic pain every single day. Eventually, the doctor may suggest an orthopedic surgeon consult. The orthopedic surgeon at that point says yes or no to surgery. If he says yes, just know that by virtue of me talking to an orthopedic surgeon himself, he said this about back surgery: they all fail eventually. So even though they have good results, pain goes away after surgery, eventually osteoarthritis forms in the area of the surgery and the patient gets back his symptoms or her symptoms that she had prior to surgery. And if there was a fusion, now there's more pressure on other areas of the spine to work harder, and they become dysfunctional as well. But what happens if the surgeon says no to surgery? Then the patient goes back to the medical doctor, and there's a yo-yo of medication, juggling act, maybe changing the meds, maybe trying physio, and basically the patient gets lost in the system. So this lady was very grateful that she came to the right person for the right job. You would not tell your plumber to put electrical currents through your house. You wouldn't tell an electrician to plumb your house either. Because we see these conditions all the time, chiropractic has been proven time and time again to be very cost effective in terms of fixing sciatic pain. So if you know somebody who has sciatica, pain going down the leg, low back pain, that low back pain may progress down the leg down the road, so don't take it lightly, even if it comes and goes. If it's coming and going, it means that there's a cause to the problem, and you need to be aware that it may become worse. Get your spines checked. Don't get lost in the system. Just thought you'd like that case because it's something that we see all the time, and I'm sure you know of people that you've talked to that had that same condition. Thank you for listening. Share our videos. Just push the like, share button, and make sure you tell your friends and family members. They may thank you forever for sharing this video and changing their lives. Take care.